Forming an optical section of the crystalline lens is an important part of the eye care professional's role, and by doing this, they can determine if the lens is clear and hasn't been affected by, for example, cataract. In order to form a lens section, we need to start with a thin slit and form a clear section of the cornea, as we have here. Once we've achieved this, we will be able to see the lens out of focus within the pupil. In order to focus the lens, we simply move the whole slit lamp forward, and we can see that this allows the anterior surface of the lens to be seen clearly in focus. In this instance, we can see the capsule, which is the very leftmost bright band, followed by a dark band, and then another bright band, which is the epithelium of the lens, and then a dullish band, which is the cortex of the lens. Moving the slit lamp forward further still, we allow the nucleus of the lens to be focused. We can see here that in this young patient this is nice and clear, as it is optically empty and appears black. We can push the slit lamp further forward again to see the posterior parts of the lens, and we can see that these are coming into focus here. Sometimes, because the pupil is quite small, we might well need to reduce the angle between the observation and illumination systems, as we've done here. We can see that the posterior parts of the lens are now clearly in focus. What we've achieved here is essentially to observe the crystalline lens as if slicing through it with light. So the illumination system in the first instance hits the capsule, and the light scatter there allows visualization of the anterior capsule. Then it continues through, and should there be something optically unclear in the nucleus of the lens, such as a nuclear cataract, that will also be observed as bright relative to the dark background. And then finally we'll hit the posterior part of the lens to see the posterior capsule.